Medicare Advantage plans offer a private insurance alternative to traditional Medicare coverage for health insurance. The most common supplemental benefits are dental, vision, and hearing, with more than 90% of Medicare Advantage plans providing coverage for one or more. These supplemental benefits, which are not available through traditional Medicare, are largely funded by rebate dollars paid by the Centers for Medicare and Medicaid Services, CMS, to private insurers. Medicare is a vital health insurance program for Americans aged 65 and older, as well as for some younger individuals with disabilities. While it provides extensive coverage for various healthcare services, it does not include certain critical areas like vision, dental, and hearing care. This lack of coverage is often surprising to beneficiaries who expect a comprehensive safety net. Understanding why Medicare supplemental benefits, also known as Medigap, do not include these services requires a look at the history, structure, and financial considerations of the program. The high need for dental, vision, and hearing care among Medicare recipients drives the high demand for supplemental benefits, said Avni Gupta, a health policy researcher who recently earned her PhD in health policy and management from the NYU School of Global Public Health and is now at the Commonwealth Fund. However, these added benefits are expensive for Medicare, which pays nearly $20 billion a year in rebates to Medicare Advantage insurers for supplemental benefits. An increasing number of low-income older adults are enrolling Medicare Advantage plans over traditional Medicare plans, a shift that may be driven by the supplemental benefits available in these plans. However, supplemental benefits may not provide full financial protection, as beneficiaries still face relatively high out-of-pocket costs and forego needed dental, vision, and hearing care. To understand whether coverage for supplemental benefits through Medicare Advantage is meeting the needs of those enrolled, the researchers analyzed nationally representative data from a 2018-19 survey of Medicare Advantage beneficiaries. They analyzed differences by income and the plan's star ratings, a measure of quality. The researchers found that lower-income Medicare Advantage beneficiaries are more likely to experience cost-related barriers in accessing dental, vision, and hearing services than higher-income beneficiaries, even after adjusting for several measures of benefit generosity. Overall, nearly 11% of beneficiaries reported unmet dental need, 4% reported unmet vision need, and 2% reported unmet hearing need because of cost. The researchers also found that enrolling in higher-quality Medicare Advantage plans, those with the highest star ratings, was associated with lower unmet needs for dental services overall and for lower-income groups, meaning that higher star ratings translated to better dental coverage. This was not true for hearing and vision coverage. However, despite CMS making higher rebate payments to Medicare Advantage plans with high star ratings, the positive impact of star ratings on dental coverage was not found to be driven by these bonus payments. This raises questions about whether the higher rebate payments to highly rated Medicare Advantage plans in the form of the quality bonus payments actually improve access to the funded services for beneficiaries, added Gupta. The researchers note that CMS should consider measuring and monitoring the coverage, quality, and equity of supplemental benefits in order to make coverage more equitable and better link rebate payments to the value of supplemental benefits for Medicare Advantage enrollees. As the popularity of Medicare Advantage plans continues to increase, there is a need for more accountability and better oversight on how rebate dollars are being used to improve equitable access to supplemental benefits covering services we all use and need, such as dental, hearing, and vision care, said Jose Pagan, a professor and chair of the Department of Public Health Policy and Management at the NYU School of Global Public Health. Good stewardship in rebate payments means that Medicare Advantage beneficiaries should get the highest possible value as a result of financial incentives. As you age, having dental, vision and hearing care is vital to your total health and well-being. Neglecting these areas may be linked to other health problems, such as heart issues, dementia, depression and increased risk of falls. One major benefit of Medicare Advantage, MA, is that many plans offer coverage for your eyes, ears, and teeth. Original Medicare, on the other hand, does not cover any routine hearing, vision, or dental care. And that can get to be expensive. For many MA plans, these benefits are already included in the plan's premium, the amount you pay each month for health coverage. Hearing care. Hearing loss can have many physical and mental health impacts. With difficulty hearing, you may be unable to participate in conversations with family and friends. And you may avoid daily activities such as going out to the store or social events. This social isolation can eventually lead to depression. Impaired hearing is also strongly linked to an increased risk of dementia, including Alzheimer's disease. Some studies have shown that certain areas of the brain that are linked to hearing and communication may shrink from hearing loss. With dementia, one of the ways you can protect yourself, and maybe slow the onset, is by exercising and stimulating your brain, says Beckett Simpson. But when you have hearing loss, there's potentially less stimulation to the brain. Understanding hearing benefits. If you have hearing issues, it's important to get treatment. Hearing aids may prevent some of these health risks and help you better interact with loved ones. Many MA plans include coverage for hearing exams and an annual allowance to help cover the cost of hearing aids. Vision care. As you age, you are at higher risk for vision problems such as age-related macular degeneration, AMD, cataracts, diabetic retinopathy, glaucoma, and dry eye. You may also experience problems with seeing objects up close, farsightedness, and needing more light to see more clearly. Vision loss in older adults is linked to increased risk of falls, dementia, and depression. It affects your ability to take part in daily activities such as driving, reading the newspaper, or watching television. By losing independence, you may be at higher risk for social isolation and depression. Vision loss can also impact your depth perception and balance, putting you at higher risk for falling. Understanding vision benefits. Original Medicare may cover certain services related to cataract surgery, macular degeneration, glaucoma, and diabetic retinopathy, but it does not cover routine eye care. Many MA plans, however, offer coverage for an annual eye exam, as well as prescription glasses and contacts. Regular eye exams are important to help identify health problems earlier and to maintain your vision. Dental care. Good oral health is also connected to your overall physical and mental health. Studies have shown that gum disease is closely associated with higher risk of heart disease and rheumatoid arthritis. Untreated gum disease may increase inflammation in the body, which can lead to damage to other tissues and organs. Maintaining healthy teeth also helps you eat a well-balanced diet. If you have extensive tooth loss, you are less likely to eat nutritiously. That's because you have difficulty chewing certain high-fiber foods such as fruits and vegetables. Studies have shown that older adults with poor oral health are more likely to be underweight or obese. Tooth loss can also impact a person's ability to speak, and it can lead to social isolation. Understanding dental benefits. By regularly seeing a dentist for checkups and maintaining good oral hygiene, you can prevent many of these issues, or you can get treatment for them. Many MA plans offer some form of dental coverage, including annual exams, cleanings, x-rays, and fillings. Some plans offer more comprehensive coverage for dental services such as dentures and root canals. If you neglect one area of your health, such as hearing, vision, or dental care, it can have a wider impact on your overall well-being. But with additional benefits to fit your needs, there may be an MA plan that can help you care for your total health and achieve your best quality of life. Historical context of Medicare. Medicare was established in 1965 as part of the Social Security amendments to address the increasing healthcare needs of the elderly population. The program was designed to cover hospital services, Part A, and medical services, Part B, focusing primarily on acute and necessary medical care. The decision to exclude vision, dental, and hearing care was largely influenced by the program's initial intent to provide essential healthcare services while controlling costs. The omission of these benefits was also reflective of the healthcare landscape at the time. Dental, vision, and hearing services were often seen as ancillary or non-essential, with many individuals relying on private insurance or paying out of pocket for these types of care. As a result, the original framework of Medicare did not incorporate these services, leading to the current situation where they are often left out of supplemental plans. Structure of Medicare supplemental benefits. Medicare supplemental benefits are designed to fill the gaps in coverage that original Medicare leaves behind. Medigap policies help pay for costs such as co-payments, co-insurance, and deductibles. However, they do not extend to non-covered services like vision, dental, and hearing care. This exclusion is based on several key factors. Focus on medical necessity. The primary goal of Medicare is to ensure access to medically necessary services. Vision, dental, and hearing services are often categorized as non-essential or preventive rather than critical medical needs. This distinction influences policymakers and insurers in defining the scope of coverage. Policy framework. Medigap policies are regulated by federal and state laws that specify which benefits can be included. These regulations have historically emphasized coverage that complements the hospital and medical services provided by Medicare, leaving out ancillary services that are not typically viewed as part of primary healthcare. Cost considerations, including vision, dental, and hearing coverage in Medicare would significantly increase the program's costs. Policymakers must balance comprehensive care with fiscal responsibility. By excluding these services, Medicare can maintain lower premiums for beneficiaries and avoid placing additional financial burdens on the program. The impact of exclusions on beneficiaries. The exclusion of vision, dental, and hearing benefits has significant implications for Medicare beneficiaries. Many older adults face substantial out-of-pocket costs for these services, leading to financial strain and potential health disparities. Research has shown that a lack of dental care can contribute to overall health problems, including heart disease and diabetes. Similarly, untreated hearing loss can impact cognitive function and social engagement, exacerbating feelings of isolation among the elderly. Moreover, the inability to access affordable vision care can lead to undiagnosed conditions, worsening the quality of life for many seniors. The absence of coverage for these essential services can create a cycle of neglect, where beneficiaries forego necessary care due to cost, ultimately leading to more significant health issues down the line. Alternatives and solutions. Despite these exclusions, beneficiaries do have options for obtaining vision, dental, and hearing care. Many private insurance companies offer standalone plans that cover these services. Additionally, some Medicare Advantage plans, Part C, include these benefits, providing a more comprehensive approach to care. These plans may offer lower premiums but often come with network restrictions and varying levels of coverage. Advocacy for including vision, dental, and hearing services in Medicare has grown in recent years. Stakeholders argue that expanding coverage would not only improve individual health outcomes but could also reduce overall healthcare costs by preventing more severe conditions that arise from untreated issues. Some lawmakers have introduced bills aimed at incorporating these services into Medicare, reflecting a growing recognition of their importance. The exclusion of vision, dental, and hearing benefits from Medicare supplemental coverage stems from historical, structural, and financial factors that prioritize acute medical care over ancillary services. While beneficiaries face significant challenges due to these exclusions, alternative options and advocacy efforts are emerging to address the gap. As the conversation around healthcare continues to evolve, it is crucial for policymakers to consider the comprehensive needs of the aging population and explore avenues to provide a more holistic approach to healthcare coverage. By recognizing the importance of vision, dental, and hearing care, we can move toward a more inclusive Medicare program that supports the health and well-being of all beneficiaries.